Hi everyone, my name is Julianna, and today Daniela and I will be going over anxiety disorders and coping mechanisms for anxiety disorders if you live with one. Before we begin, I will just be going over the land acknowledgement for Toronto, where X University is located. Toronto is in the Dish with One Spoon territory. The Dish with One Spoon is a treaty between the Anishinaabe, Mississaugas, and Haudenosaunee that bound them to share the territory and protect the land. Subsequent Indigenous nations and peoples, Europeans, and all newcomers have been invited into this treaty in the spirit of peace, friendship, and respect. So today we'll be going over quite a few things. First will be an introduction, some warning signs, generalized anxiety disorder, obsessive compulsive disorder, panic disorder, post-traumatic stress disorder, and social anxiety disorder. Then I will pass it over to Daniela, who will speak about myths about anxiety disorders, coping with anxiety disorders, supporting a loved one, supporting a client, some resources, and finally some important points to remember. So to begin, an anxiety disorder is a type of mental health condition, and those who experience anxiety may respond to certain situations with fear and dread. However, there are also physical signs of anxiety, such as sweating and a pounding heart. Anxiety is a normal part of life, but sometimes anxiety can become overwhelming and does not go away and can even get worse over time. Anxiety disorders involve more than just a temporary worry or fear. Anxiety disorders make it difficult to get through the day, but fortunately, there are several effective treatments for anxiety disorders. There are also several types of anxiety disorders, and we will go over many of them in today's video. Before we begin going over the different anxiety disorders, most of them do share similar warning signs, so I believe it's important to go over this before we begin. So some people can be predisposed to anxiety disorders, meaning that they have a higher risk for developing anxiety disorders. This is usually because of a mix of genetic and environmental factors. You may be at higher risk for developing an anxiety disorder if you have or had shyness or behavioral inhibition, feeling uncomfortable with or avoiding unfamiliar situations, environments, and people, stressful or traumatic events, especially during childhood or early adulthood, a family history of anxiety or other mental health conditions. And anxiety has also been found to occur much more often in women than men. The first anxiety disorder we'll be going over today is generalized anxiety disorder. Or GAD. So GAD is characterized by persistent and excessive worry. Most often the worry is about money, health, family, work, or school. Individuals with GAD find it difficult to control their worry and may worry more than seems necessary, such as expecting the worst about actual events happening to them, or even worry about situations that are unrealistic or have no chance of occurring. GAD is diagnosed when an individual finds it difficult to control their worries on more days than not for at least 6 months or more. This timeframe allows for professionals to differentiate between GAD and worry that may come from a specific stressor from a more limited period of time. They also typically experience 3 or more of the following symptoms: feeling nervous, irritable, or on edge, having a sense of impending danger, panic, or doom, having an increased heart rate, breathing rapidly or hyperventilation, sweating and or trembling, feeling tired or weak, or having difficulty concentrating, having trouble sleeping, and experiencing gastrointestinal problems. Finally, we'll go over some treatment. So the most common treatment for GAD is CBT, which is cognitive behavioral therapy. And cognitive behavioral therapy is used to change thinking patterns and behaviors. CBT is often associated with lower anxiety symptoms within 12 months after treatment. So this is pretty successful. As well, medication can be used. There's 2 types of medications that can be used. Short-term medications, which are mostly used to relax the physical symptoms of anxiety. These include Xanax and clonazepam. Or long-term medications or antidepressants such as Lexapro, Prozac, Pristiq, or Zoloft. Next is obsessive compulsive disorder, or OCD. Individuals with OCD experience obsessions and compulsions along with their anxiety. Many individuals recognize that their obsessions and compulsions are not rational, but still feel the strong, compelling need to perform the repetitive behavior. However, in OCD in children and teens, they may not recognize the excessiveness. Obsessions are intrusive, unwanted thoughts and sometimes disturbing images or urges that can cause an individual distress and severe anxiety. Common obsessions include concerns about contamination, cleanliness, aggressive impulses, or the need for symmetry. Compulsions, on the other hand, are behaviors that an individual feels compelled to perform in order to relieve their anxiety. Common compulsions include checking, counting, washing, or cleaning, and arranging. Individuals with severe OCD may spend several hours focusing on their obsessions and compulsions, seemingly performing rituals that interfere with their normal routine, such as schoolwork, their job, their family, friends, and social situations. However, there is treatment if you do suffer from OCD. Proper treatment helps those suffering regain control over their life and relief from the symptoms of OCD, specifically their obsessions and compulsions. Most effective treatments include cognitive behavioral therapy and/or medication. The type of CBT that is most effective is called exposure and response prevention. Exposure refers to exposing yourself to the thoughts, images, objects, and situations that make one anxious and/or start one's obsessions, while response prevention refers to making a choice not to do a compulsive behavior once anxiety or obsessions and compulsions have been triggered. You may also use medication, and medication used for this are antidepressants, again, such as Zoloft, Lexapro, or Prozac. Now we move on to panic disorder. Panic disorder is diagnosed in people who experience spontaneous panic attacks and are very worried about a reoccurring attack. These attacks can occur unexpectedly, sometimes even waking one up from their sleep. Panic disorder usually begins in adulthood after age 20. Panic disorder is twice as common in women than in men and interferes greatly with daily life, causing some people to miss work, go to many doctor's appointments, and avoid situations where they may experience a panic attack. Many people do not know that panic disorder exists and that what they are experiencing is valid. This causes them to feel afraid or embarrassed about what they are experiencing. Panic disorder is highly responsive to treatment, and these types of treatments include antidepressants and cognitive behavioral therapy. Next is post-traumatic stress disorder, or PTSD. PTSD is a potentially debilitating condition that can occur in individuals who have experienced or witnessed some type of traumatic event, such as a natural disaster, a serious accident, a terrorist attack, the sudden death of a loved one, war, or physical or sexual assault. Many of these survivors may experience flashbacks, nightmares, or intrusive memories about the traumatic event, or these symptoms can be triggered when another terrible event happens. Most people who experience traumatic events recover from them, but those who develop PTSD continue to be severely depressed and anxious for months and even years after the event occurs. Women are twice as likely to develop PTSD as opposed to men or children. PTSD often occurs with depression, anxiety disorder, and substance or alcohol abuse. Survivors may have trouble maintaining relationships with their families or friends, as their symptoms can cause problems with trust, closeness, communication, and problem solving. However, once again, PTSD is treatable, and treatment involves psychotherapy such as CBT. This type of CBT will use exposure therapy to face and control their fears, as well as cognitive reconstructing to help make sense of bad memories and to help them get a realistic perspective of their trauma. Treatment can also include the use of antidepressants or anti-anxiety medication. Finally, we move on to social anxiety disorder. Social anxiety disorder is defined as the intense anxiety or fear of being judged, negatively evaluated, or rejected in a social or performance situation. Many worry about appearing or acting anxious in front of others or being viewed as awkward or boring. They may also experience significant anxiety and distress dealing with physical symptoms such as rapid heart rate, nausea, and sweating. They can also experience panic attacks when confronting a feared situation as they feel powerless against their anxiety. Social anxiety disorder is often diagnosed in individuals who experienced extreme shyness in childhood, but it is important to note that social anxiety disorder is more than just shyness. It can be debilitating and wreak havoc on the daily lives and routines of individuals suffering. Fewer than 5% of individuals with diagnosed social anxiety disorder seek treatment despite the availability and effectiveness of resources and treatment around them. The treatment for social anxiety disorder includes the use of CBT, specifically exposure-based therapy, as well as antidepressants such as Paxil or Zoloft, and as well as anti-anxiety medication for short-term use.
Myths about anxiety disorders. There are various myths about anxiety, each of which is harmful to both the larger discussion of anxiety and to the individuals who have it. These statements perpetuate stigma and keep mental health stigmatized. However, by educating yourself on anxiety and how to support someone, it can help to deconstruct the stigma. The first statement we'll look at is, anxiety is not a real illness. This is harmful as anxiety is a real illness that many people have. It can cause difficulties with functioning on a daily basis and can lead to other mental illnesses down the road. The next statement is, time will help. This can lead to the belief that with time, anxiety will get better. However, sometimes professional help is needed to manage these symptoms, and the statement can bring about harm as people will be less likely to seek help. The next statement is, stop thinking negative thoughts or stop being anxious. Anxiety is not something that can be turned off, and this is a common misconception about it. This statement can bring about harm as it invalidates the struggles of someone and can lead to stigmatization. The next statement is, everyone gets anxious, it's no big deal. While everyone does get anxious from time to time, and anxiety is a normal feeling, this sentiment brings about harm, as to the individual it is a big deal. This invalidates their feelings, which can result in the worsening of symptoms or can lead to self-stigmatization. The final statement is, you're overreacting. This statement causes harm as the anxious feelings seem real to the individual and often have a direct trigger. It's important to deconstruct where these thoughts come from in order to work around the stigmas surrounding anxiety. Without this, it becomes impossible to fully support someone with anxiety. Coping with anxiety disorders. To start, work on questioning your anxious thoughts. It can be easy to get stuck in patterns of negative thinking and about the whys. To best cope with these thoughts, challenge them. Think about, why am I thinking this and why I believe this is true. If you think about why you believe it's true, it can help to deconstruct the thought and see why it could be inaccurate. By continuously questioning patterns of negative thinking, you will be able to better see a situation as it is and avoid thinking about anxiety as being dangerous. Breathing techniques can also be useful. Square breathing, where you breathe in for 4 seconds, hold for 4 seconds, breathe out for 4 seconds, and rest for another 4 seconds, can be helpful to center yourself when anxious. Often it can be easy to forget to breathe, or you might find yourself holding your breath subconsciously when anxious. Therefore, it's important to remember to breathe in times of stress. A daily routine can also help manage symptoms. By adding routines such as exercising, meals, and other methods of self-care, it can help manage anxiety. Journaling is another beneficial method, as writing what you're anxious about or about your day can help put perspective and get the thoughts out of your head and onto paper. Finally, talk to someone. A loved one, trusted individual, or a therapist can help you. By talking about it, it puts you in control of your anxiety, and you can move forward and learn how to manage it. To continue with coping with anxiety disorders, a helpful trick for panic attacks that many people use is to eat sour candy or ice. By doing this, it can act as a distractor from the panic attack, either stopping it or stopping it from worsening. Most important to know is that feelings of anxiety are not dangerous, and they cannot harm you. Feelings of anxiety from time to time are completely normal, and there are ways to cope with them. Supporting a loved one. There are various ways you can go about supporting a loved one who's struggling with anxiety. First, learn about the signs. By noticing the signs of anxiety, you can best support someone. Symptoms and needs range from person to person, but by knowing the individual's triggers and signs, You can help them when they're having an anxiety attack or feeling anxious. This can also help you to notice when they're starting to feel anxious so you can help bring them back. Validate how they are feeling. Due to the stigmas many face, it can be difficult for many people with anxiety to be validated in their feelings. Sometimes it may be difficult to understand why they are anxious in that moment, but by validating them and acknowledging that it is real for them, it can provide support. When anxiety is bad, it can be beneficial to help them receive professional help. By encouraging them, it can make the experience less stress-inducing and can help them deal with the self-stigmatization that's involved. Don't enable their anxiety. This can be done by helping them avoid, and while it's done with good intentions, it can cause more harm than good, as they will continue to avoid as they can rationalize a reason to avoid. To best support them, help them maneuver through anxiety-provoking situations. Another method to support a loved one with anxiety, and probably the most important one, is to ask them what they need. Needs for support differ as people with anxiety disorders have different symptoms and experiences. Since no two people are the same, it's important to ask what they need because sometimes those needs also differ from time to time. This can also be the best way to support as it validates their needs and allows them to feel supported. Also important is to look after yourself. It's important to look after yourself as it can bring about stress supporting someone with anxiety. Ensure to establish boundaries and look out for your own well-being through self-care and other methods. Supporting a client. There are various ways that a practitioner can help support a client with anxiety. It's important to understand what keeps feelings of anxiety and not to search for the whys, such as, why am I so anxious? By searching for the whys, clients feed into anxiety and it does more harm than good. Therefore, it's important when supporting a client with anxiety to look for what maintains these feelings of anxiety and work on those, rather than searching for all the whys. Help your client stop their need for control. Often people with anxiety like to control their environment as a method of coping, but this does more harm than good. It can be beneficial to teach your client how to maneuver through what they cannot control and to give them the appropriate tools. Work on safety behaviors. These behaviors are used in order to help a client cope with anxiety, but in actuality, they help avoid. This feeds into feelings of anxiety and continues the cycle. Therefore, to best support a client, it can be helpful to have them identify what their safety behaviors are and work on how to get rid of them and cope without them. Often clients with anxiety tend to rationalize their worries. This provides false validation and does more harm than good. Instead, teach them how to work with these feelings of anxiety. Find their triggers and learn how to manage them. Often clients may not know what directly causes their anxiety or a panic attack. Therefore, it can be beneficial to find out what triggers their anxiety and work on that, rather than working directly on trying to cure anxiety. Another technique that can be used to help support a client with anxiety is a fear hierarchy. A fear hierarchy is a technique used to list different anxiety-provoking activities, such as ordering a coffee, starting small talk, or talking during a group meeting. These activities are listed and measured in terms of what would cause the most fear and what would cause the least. Then a client works on these activities, starting from the least fearful activity and moving on until they reach the top of the hierarchy. This is an example of exposure. Small everyday exposures can also help clients, since with practice certain activities will not be as stressful. What's most important is to remind your client that it is normal to have feelings of anxiety, and everyone gets anxious from time to time. However, it's not dangerous, and there are ways of managing these symptoms. Next, we'll go over some resources. The most important thing to take away from this video is that there is help and supports available. For an immediate mental health crisis, reach out to a crisis line for support. For a non-immediate mental health crisis, a useful resource is For a Safer Space. For a Safer Space is a non-profit that offers accessible and inclusive mental health care. Visit the website for more information if you would like to reach out for support. To conclude this video, we'll go over important points to remember. Anxiety is a normal part of life, but sometimes it can become overwhelming. Anxiety disorders occur when individuals become fearful of certain situations and can result in physical symptoms. There are several effective treatments for anxiety disorders that can help manage them. There are also 5 main types of anxiety disorders, which include generalized anxiety disorder, obsessive-compulsive disorder, panic disorder, post-traumatic stress disorder, and social anxiety disorder. To continue on important points to remember, there are many myths and misconceptions about anxiety which perpetuate stigma. There are also many ways that someone can cope with anxiety disorders, and while it will not remove anxiety completely, they will help manage symptoms. Many steps can be taken by loved ones to support someone with anxiety, but it's also important to look after yourself first. Practitioners can work with clients and provide them with various tools to manage their anxiety. Most important to remember, anxiety is not dangerous and cannot cause harm. Feelings of anxiety are common and normal, and there are ways to manage them. That concludes this presentation on anxiety disorders and coping. Thank you for watching.